Hi, my name is Marlene. I'm a staff nurse working in PCCU at University Hospital.
And I'm Allie. I'm also a staff nurse working at University Hospital.
Hello, my name is Ismael Lopez. I'm a registered nurse, and today I want to talk to you about congenital heart defects.
Hello, my name is Tanya Lopez, and I would like to say a quick note to you today to you mothers that have your infants dealing with serious issues.
I understand that your child was born with one, and I want to make sure that you guys understand what that is. First, it is a structural defect that your child was born with. This does not mean that they cannot live a regular, active, and healthy life.
As far as questions from patients, it's what is my child gonna be able to do, or when can they go out of town, when can they have an actual bath, stuff like that. And it just all depends on their patient and what they have done and what's going on with them, but not to let that deter them from thinking that they can't go out of town and can't do things like go swimming and things like that. Eventually they can lead a more normal life, but usually post-op surgeries, they have to wait a couple weeks before they can start doing things like that.
Sometimes it's also depending a lot on the patient. Two patients could have the same surgery, but it really just depends how they heal and just different factors that come into play, different treatments they're getting. So it all just depends on the patient's symptoms.
Symptoms that you need to look out for are shortness of breath, bluish color in the lips and the nail beds, which means that they're not receiving enough oxygen overall. Also dizziness, and then and heart palpitations.
I am a mother that have dealt with my daughter having juvenile myoclonic epilepsy with seizures, and I understand the struggles that you are going through on a daily basis.
So how do we manage this?
Utilize your other family members. I know sometimes, especially grandparents, they always want to help. They're always let me have that baby or whatever. So definitely utilizing the time that they can, take a date night, take a nap, take a shower, and you can leave your baby alone for a second. You don't have to, whether they're a newborn or older. Once they are healed and stuff, just make sure, because it's a lot of work, especially with kiddos that do go home with complications or needing a certain equipment or feeding pumps, things like that. Taking time for yourselves is really important. And then also seeking what their insurances provide, because sometimes they provide a respite person that can come in for a couple hours, and they're trained, and they at least know BLS or ACLS, PALS, those kind of things, and know how to do things. So that way it's some sort of trained professional, not just a random nanny or something.
You guys need any advice on how to deal with your child? There's always somebody you can reach out to.
We're also here, the nurse, as nurses, we're here to monitor the patient. It's fine, you've been here a long time, you can take breaks and then come back whenever.
Find somebody that you can depend on, whether it's your spouse or your best friend or somebody.
Kind of vent to each other.
It's hard and it's stressful, and you need someone to vent to and get some time, even if it's just a phone call, or find somebody that you can lean on.
Just go get a snack or take a nap, and then there's support groups.
It is hard, but be patient, and eventually you're gonna have a great, your baby can live and do whatever they want. Just because they have a medical condition doesn't mean that they're not capable of having a good life and achieving things that maybe people think they'll never achieve. So I think just be patient, and you'll learn that your baby can exceed expectations.
I send you lots of love and prayers, and I advise you to follow the doctor's instructions and to pray and have faith in the process.
Take it day by day. Don't lose the hope. It might seem very scary, but things do get better. And then just always, be hopeful, and everything will turn out good at the end.
Just focus on one day at a time.
This time I want to make sure that you guys are clear in everything that we discussed. We discussed what the heart defects is, or congenital heart defect is, the management, and the symptoms that you need to look out for. You guys got this.